Hi, I'm Femi OK, and you're in the stream.
And I'm Malika Bilal. Today, a mental health crisis in Nigeria. A group of mental health advocates discuss the unconventional approaches helping to tackle the problem.
And we want to hear your thoughts, so tweet us at ajstream or leave a comment in our live YouTube chat, and you could be in the stream.
3 in 10 Nigerians suffer from mental health issues, according to the country's Ministry of Health.
And resources to help those in need are scarce, so many mental health advocates have taken unconventional approaches to tackling the crisis. Joining us to discuss this in Abuja, Nigeria, Dr. Abaye Ora Ainama. He's a socio-cognitive research psychologist with the Neem Foundation.
In Lagos, Hawa Ojevo, she's the executive director and founder of She Writes Woman, which aims to raise awareness about mental illness by giving a voice to those struggling. In Maiduguri, Dr. Ibrahim Wakawa, he's a medical director at the Federal Psychiatric Hospital, Maiduguri. It is one of only 8 public mental health facilities in the entire country.
And in London, Dr. Victor Ugo, he's the founder of the Mentally Aware Nigeria Initiative, or MANI. It's good to have you, everybody. Thanks for joining us in the stream. Victor, I'm going to do something that is not heard very often on TV in Nigeria, and that is for somebody to talk about their mental health. Can you tell us, just very briefly, how you tackled your mental health challenge? What happened to you? How did you solve it?
Yeah, I don't think I've solved it. Thank you for having me on the show. I don't think I've solved it, but how I've dealt with it has been, it's more or less like when I was diagnosed with depression, I had a lot of support from my friends and from my family as well. And that went a very long way in my recovery journey. And I've had that support ever since. And that's one of the reasons why we decided to start up a community of people that have experienced mental health issues so that we can all act as some kind of support for each other.
If we were looking, Dr. Abaye, at the extent of mental health challenges in Nigeria, how would you explain the landscape? What is it like? What's treatment like?
I think a lot of the concern about the mental health challenges in Nigeria is as a result of the crisis in the Northeast. To put things in perspective, over 7 million people have been affected in 3 states in the Northeast of Nigeria. Out of those 7 million people, 1.76 people have been displaced from their ancestral homes. You have people from teachers to farmers to government workers and fishermen lost everything they've ever owned. So these people suffering from really massive trauma with the occasional secondary symptoms such as depression, anxiety, and stress. A lot of them have very little light left. And however, the crisis in Nigeria is not only in the Northeast. There are several conflicts all across the country. There's a conflict in the Northwest, and the bandits and resource-based conflict. There's a farmer-headed crisis in the Middle Belt. There's crisis in the Niger Delta as a result of resources and cultism and so forth. So these conflict-induced mental health challenges are a serious problem in the country, together with the economic situation.
And I hear what you're saying there, and yet there are a handful, I will say, there are not that many, but there are a few people online who are not quite convinced that the numbers are adding up or that the level of people wanting to seek mental health care or dealing with mental illness are what the government says they are. So I wanted to share this from Kike, who says, our government officials are known for cooking up numbers. Did the numbers come from a personal observation, from a village or legitimate survey? If so, how was the survey conducted? What region was focused on? She goes on to say, in a country where mental health is viewed as a taboo topic, I'm curious to know who they talk to. I digress from the question. Mental health is a very important topic that's needed to be tackled with a sense of urgency, but these numbers just don't add up for me. And the number she is talking about is the 3 in 10 Nigerians who reportedly suffer from mental health issues. Dr. Ibrahim, can you talk to us about what we know about the landscape, what we know about those numbers?
Yeah, thank you very much for the opportunity. I think the number is overestimated. I share with the concern that there's a mental health issue in the Northeast, particularly with the displacement of over 2 million people by the insurgency, and particularly with the destruction of health infrastructures, both at the primary and secondary care levels in parts of Borno State and Yobe State, and of course in some parts of Adamawa State. And there's growth deficiency of mental health facilities in Nigeria. The only mental health hospital that is owned by the federal government is the Federal Neuropsychiatric Hospital here in Maiduguri that caters for over 22 million people. And there's also growth deficiencies of psychiatrists in Nigeria. With a projected population of over 200 billion people, Nigeria currently has under 200 psychiatrists, which makes the ratio of a psychiatry to the population of about 1 to a million, which is grossly inadequate compared to the specifications and WHO recommendations of 1 psychiatrist to 10,000 population. And of course, there's emergence of other disorders like post-traumatic stress disorder with the insurgency. And of course, recently, there has been an upsurge in the suicide rate, which of course is indicative of deteriorating mental health condition. But the methodology and the methods they use in arriving at the figures, I think, needs much to be desired.
Howard, it's almost impossible to talk about mental illness as if it's just one kind of illness, but from your perspective, when you look at suffering or having a mental illness issue in Nigeria, who do you go to? Who's there to help?
Thank you very much for having me, Tammy. I think, first off, the landscape of mental health in Nigeria is very fragmented. I mean, generally speaking, the healthcare system is quite fragmented. It's quite dysfunctional, if you ask me, to put it very loosely. So the average Nigerian really doesn't know where to go. Yes, they say go to the doctor when you feel like there's something wrong with you, or you feel ill, or you're sick. But a lot of times, the general practitioners or the conventional doctors are ill-equipped to deal with or to spot the symptoms of mental health problems, and it just becomes really hard. I mean, of course, we also have other factors, social, cultural, religious factors that sort of enable and counter any form of awareness. So it's kind of like.
Do you want to explain what that means? Because it's a very easy sentence to say. Social, cultural, religious factors, as if everybody knows. Every Nigerian will know this. But internationally around the world, pick one of those and explain what you mean.
Okay, so for example, I'll look at the religious aspect. Nigerians are very religious people. You could say it's one of our biggest weaknesses and one of our biggest strengths as well. So for example, you would hear somebody who has depression would say, oh no, God forbid, I don't have depression. It's like a demonic possession. Or, you see it evident in the fact that there are so many traditional and healing camps across Nigeria where people are being flogged and their rights are being violated because they have a psychosocial disability or a mental health condition. And so the belief is that if we flog it out of you, then maybe the demon will leave and things like that. So we see those kinds of narratives. That's just one aspect of the religious narrative. We see those kind of narratives enabling people, sort of shifting the way people think about mental health in the sense that if I know that I'm dealing with something, I wouldn't be able to talk because guess what? I don't want to fall in line with the narrative that there is something wrong with me in terms of spirits, possessing me or demons, and then perhaps I need to be flogged. So those are the kinds of things that hinder people. But generally, it's such a way that the system is not very integrated. And that's one of the things that we try to advocate for, integrative mental health care, especially at the grassroots level. For example, the primary health care level. At the grassroots, there is no mental health care where people can go to and say, okay, I'm dealing with this. I don't even know what it is, but at least the professionals, the health professionals or practitioners will be able to spot it, to be able to say, this is a mental health issue. But currently, I don't see that happening in the country at all.
Howard, I'm glad you brought that up because we got this comment from someone watching on YouTube. This is Alexander Anderson who says, we have to bring in religious leaders into this conversation. I pray at mosques and not once have I heard the issue of mental health being discussed. I can't speak for churches here, but he goes on to say, usually religious leaders, tell you to pray and that's it. I think there should be an open discussion about how prayer doesn't always solve our mental health challenges. So let's dig right into that topic, the stigma that goes along with this and the things that are not so helpful that others from the community might tell you to do. Dr. Abiye, do you want to take that on?
Sure. I think the backlash against the research, 1 in 3 Nigerians suffer from mental health issues, it's really indicative of the problem. When we run advocacy and sensitization campaigns, we try to make people aware that mental health problems are just like physical health problems. They can range from physical problems, from headache to full-blown cancer. It can be the same thing with mental health. It can range from perhaps minor depression to full-blown psychosis. Right, but in Nigeria here, we have a very myopic view of mental health illness. We think anybody that suffers from a mental health issue is mad, and they have various names for it. You know, they would say that one don't mad, that one don't colo, that one don't mental, just several names, just really, really myopic view of it. I think we have a long way to go in sensitizing Nigerians. That mental health issues, you know, can range from the really mild to really severe problems in the country.
Dr. Ibrahim, how do you take that on? I mean, as a federal medical director, this is your job to maybe work out how the government can help Nigerians handle and treat mental illness. How do you take on that stigma? It's really, really deep.
Yeah. It's a very valid observation that Nigerians generally have a misconception and misperception about mental illness, but the federal government on its part particularly has been doing a lot. The levels of healthcare in Nigeria are divided into three. That's the primary healthcare, which is handled essentially by the local government areas, and the secondary healthcare, which is statutorily handled by the states, and then the tertiary healthcare, which is the prerogative of the federal government. The federal government has established about 8 neuropsychiatric hospitals in the country to cater for the geopolitical zones, and the federal government has also engaged the specialist hospital in the training of primary healthcare workers in the provision of mental health services at the grassroots through the Mental Health Global Action Plan intervention guides. In several parts of the country, several primary healthcare workers have been trained on the detection and early intervention of mental illnesses at the grassroots level. And then secondly, there has been an integration of mental health into trado-medical care. What I mean by this is that there has been engagement of traditional rulers, and of course, to some extent, trainings have been conducted for spiritual leaders such as pastors and imams in certain parts of the country. I can clearly attest to this intervention in northeastern part of Nigeria, in which so far we've trained over 250 primary healthcare workers, and we've also engaged religious leaders such as the pastors and imams in actually teaching them destigmatization strategies. I think this will go a long way in yielding positive impacts if the tempo is sustained and if it's elongated.
And of course, that would help perspectives like this. This is Joey who says there is a stigma attached to having mental health issues here. And along with that comes a conspiratorial shroud of silence. So it's that idea that you can't talk about it. That we got a video comment from someone who picks up on that idea. This is Anto Lekki. She's a media personality in Nigeria. And here's what she told us.
When it comes to mental health in Nigeria, people believe that it's a curse, that a witch in your village somehow put it on you. Because of the traditional, religious, and cultural reasons, people don't give mental health the respect or the attention that it needs. Luckily for today, the stigma is changing a bit, but definitely not enough. There are people who have access to more education because of the internet, because of social media, because of NGOs and doctors, but that is just maybe the 1% of the 1%.
So Dr. Victor, she says it's changing, and I would venture to say it's changing in part because of organizations like yours. You have trained counselors ready to talk to people. Tell us about how that works.
Yeah, so we started up this, should I say, the text line 2 years ago. And since then, we've managed to reach out to more than 10,000 Nigerians in 28 months. And what happened is that we have psychologists and counselors who are trained in problem-solving therapy on WhatsApp. So it's a WhatsApp group, basically. And when we get messages on Instagram and on Twitter, we connect these people that need help and services to these counselors who we have trained already. And, with more or less supervise and facilitate the conversations between them. And we've seen increasing, I think more people are reaching out for sure, but I wouldn't say that the stigma is getting any better, or would I say that the stigma is actually the problem? I mean, from experience. I would say that the lack of actual quality services is an evidence-based issue that needs to be countered. Because if you do too much awareness,
Victor, what does that mean?
yeah. So if you do too much awareness services or awareness programs, you're going to increase the demand of mental health services. Now, if you increase the demand with the paucity of capacity for mental health service provision and the paucity of facilities to provide these services, you're going to cause an unintended consequence, which means that they're going to go to the hospitals, they're going to find them more crowded, and it's going to somehow like cause a negative kind of effect, because then the stigma is going to increase. So it's not really just about improving the awareness program.
Howard, go ahead, jump in.
Okay.
Yeah, so I think I agree with what Victor is saying in part as well, but I also want to shed some light into, it's very easy for us to look at mental health and say, oh, maybe stigma is the issue, or, all of the mental health or mental illness is the issue. But I think it's also very important for us to look at prevention, because we're a very large country. Nigeria is. It's not enough for us to always look at mental health from a response point of view. We are largely under-equipped in a systemic way. We're talking about very, very few psychiatric hospitals. But the truth is that not every situation that every Nigerian is dealing with, if they have any mental health condition, is full-blown into something that requires tertiary intervention. We need primary health care. We need grassroots. We need to be able to build capacity. And I would just want to sort of counter what was said regarding the government's response to that. I don't particularly believe that the government is doing enough. I believe there has been some stride, yes, but I don't think it's been enough. I don't think in 2019, Nigeria is still using a Lunacy Act of 1959 shows the readiness of the government. I don't think it shows that they're serious. I don't think it shows that they're protecting the rights of people who live with mental health conditions. I believe the government can single-handedly, in collaboration with civil society organizations like She Rights Women and Mani and NEEM Foundation, conduct global awareness, nationwide awareness, but also ensure that how can we collaboratively build capacity at a grassroots level? How can we, collaboratively build community youth-based mental health centers, so that when we're raising the awareness and increasing the flow to these centers, there are people there to begin to take people in.
Dr. Ibrahim, can you respond to that just briefly?
What she said, it is true. There's Nigeria currently operates the Lunacy Act, which we felt it's very, very archaic, and to that, significant progress has been made. The revision, which is compatible with global realities of the time, had been submitted to the National Assembly, and currently it's been deliberated upon. It's at the third level of hearing before the dissolution of the last session of the National Assembly.
And how might that help, Dr. Ibrahim, how might that help updating a 1959 Lunacy Act, even the terminology is old-fashioned, and update it so you've got something for 2019? Just briefly, how will that help?
The helping is that it takes into right the human rights of the clients. It takes into cognizance the negative terminologies and stigma that have been used, and it gives the client the powers to determine, the power and autonomy to determine what is being done to him, unlike the Lunacy Act that invests most of the powers in the hands of the clinician and the magistrate.
I want to share one other aspect in which people think the government can be doing more on, and this is via a video comment from a registered nurse who interviewed nurses and medical professionals in Nigeria for his research. Here's what he told the stream.
I think one of the most easily neglected issues around the development of mental health issues in Nigeria is the lack of government resources, lack of government support for professionals working within the field. Imagine people telling you, nurses telling you, sometimes we're like 2 on the wards of like 20, 30 patients, and we have to manage them.
So you heard him put the onus there on the government, but there's someone online who's saying it's not just the government. This is Femi, who says on the diagnosis side, there are very few groups, centers, hospitals that support mental health. It's a social aberration to even mention seeing a psychologist or psychiatrist. Public and private sector wouldn't consider investments in mental health because it's seen as unprofitable. So he's putting some of the onus there on the public sector, Dr. Abiye.
Yes, that's true. I mean, it'll be highly unprofitable when you have no clients. So back to the formal argument, I think we don't have to take one side and leave the other in terms of creating awareness of mental health issues and provision of mental health facilities in the country. I think we have a lot of work to do in both ways, and we don't have to forgo one for the other. Certainly not. And I'd like to return back to the issue of this religious approach to mental health issues in Nigeria. I think there's a much more serious problem that we're talking about here. And that you wouldn't really find it in the cities, but more so in the rural areas where people with mental health challenges are denied of the basic human rights and treated in the most abysmal ways. Where you have this religious charlatans, be it from the church or the mosque, exploiting these really vulnerable people and gaining from them. I think the government needs to do a lot more to that regard as well. They need to provide more checks for these religious charlatans who claim to be providing services that they can't possibly provide. And also, I think training religious leaders, has its pros and cons. We also do some training as well at the community level, but it's essential that we let them know that they're just first-line respondents to provide really basic mental health first aid, and if the problem is serious, to pass it on to the appropriate practitioners and not take matters into their hands. Now, training these people might give them the false sense of competence that they might be able to handle really serious mental health issues. So I think that's something that we need to take into consideration.
All right.
That might be, sorry.
Yes, Howard, go ahead. Howard, go ahead.
So I was just going to say, like, it's very interesting because, like you said, obviously it's not, solving the mental health crisis in Nigeria is not any one group of people's responsibility. It is not particularly the sole responsibility of civil society organization. Neither is it the sole responsibility of the government. But I think something that is really, really important for us to take into consideration in addressing any kind of crisis, including the mental health crisis, is just understanding that nothing about us without us. It's about including the people who have these psychosocial disabilities and mental health conditions in the process of making policies, the process of creating solutions, and just being able to manage your own conditions as well.
Dr. Victor, I want to play this from the MANI website. Let me just remind everybody that MANI is the Mentally Aware Nigerian Initiative. The MANI has won awards for their work. Have a look here.
The nation's doctors are working to convince the public that mental health problems can and should be treated.
According to health officials, there are only 130 psychiatrists in Nigeria, while there are more than 20 million people suffering from various types of mental illnesses.
That statistic is scary, and I know Dr. Ibrahim mentioned that earlier, but Victor, I am just wondering, we have 3 doctors on Al Jazeera's The Stream right now. Nigerians love doctors. There are doctors and lawyers. If you become one of those, your parents will be very happy, maybe an engineer as well. Why is it that there aren't more psychiatrists, psychologists in Nigeria if Nigerians love the medical profession so much?
Well, for sure, the stigma plays a very, very big role. A very, very big role. And the fact that there are not so many training facilities as well. So there's not much that can be done in terms of producing more doctors. But I believe there are more doctors in training at the moment. So when that statistic is given, it's talking about specialists, not actual doctors in training.
Sure.
But another issue is that we have psychiatrists leaving the country, going to the UK, to the US, where there are obviously greener pastures. So that doesn't really help. And then we have medical students not intending to choose psychiatry. When I was in medical school, I had some of my senior professionals laughing at psychiatrists. It's a very stigmatized profession as well.
Right.
So that's a very, very huge problem.
You've got to destigmatize it from within the medical profession, not just from outside as well. Malika.
I'll end with this from Mohammed on Twitter, who says, to curb this as a society, we need to realize that depression is an illness that should be treated the same way that we treat any other illness.
Thank you very much to our guests. The conversation continues always online. You can find Malika and myself at ajstream. See you next time. Thanks for watching.